Conjunctivitis, also called pink eye, is defined as inflammation of the conjunctiva. The conjunctiva is a thin membrane that lines the inner surface of the eyelids and the whites of the eyes called the sclera. There are 5 main types of conjunctivitis, namely viral, bacterial, allergic, toxic, and non-specific. Most cases of infectious conjunctivitis are viral in adults and children. However, bacterial conjunctivitis is more common in children than in adults. First up, viral conjunctivitis. Viral conjunctivitis is typically caused by a virus that can also cause the common cold. A person may have symptoms of conjunctivitis alone or as part of a general cold syndrome with swollen lymph nodes, fever, sore throat, or runny nose. Viral conjunctivitis is highly contagious. It is spread by contact, usually with objects which have come into contact with the infected person's eye secretions. For example, the virus can be transmitted when an infected person touches their eyes and then touches another surface like a door handle or shares an object that has touched their eyes, example, a towel or pillowcase. The most common symptoms of viral conjunctivitis include redness, watery or mucus discharge, and a burning, sandy or gritty feeling in one eye. Some people have morning crusting followed by watery discharge, with some scanty mucus discharge throughout the day. The second eye usually becomes involved within 24 to 48 hours. Usually, there is profuse tearing rather than discharge. There is no treatment for viral conjunctivitis. Recovery can begin within days, although the symptoms frequently get worse for the first 3 to 5 days, with gradual improvement over the following 1 to 2 weeks for a total course of 2 to 3 weeks. Next up, bacterial conjunctivitis. Bacterial conjunctivitis is highly contagious, often affecting multiple family members or children within a classroom. Just like viral conjunctivitis, it is also spread by contact. The most common symptoms of bacterial conjunctivitis include redness and purulent thick discharge from one eye, although both eyes can become infected. The discharge may be yellow, white, or green, and it usually continues to drain throughout the day. The affected eye often is stuck shut in the morning. A type of bacterial conjunctivitis known as hyperacute bacterial conjunctivitis is usually caused by Neisseria infection. These can be severe and sight-threatening. Such patients require urgent ophthalmology referral. The third type of conjunctivitis is allergic conjunctivitis. It is caused by airborne allergens that come into contact with the eye. Itching is the cardinal symptom of allergy, distinguishing it from a viral etiology. It may be sudden in onset, seasonal, or present all year round, depending upon the allergen. Examples of allergen include animal danders, commonly from cats and dogs. Danders are invisible dead skin cells that shed naturally as part of the normal growth cycle. Other allergen includes pollens from grass and weeds, molds, and dust mites. Another rare type of conjunctivitis is known as toxic conjunctivitis. It is caused by chronic inflammation of the surface of the eye from an offending agent, usually from a preservative of a medication. Toxic conjunctivitis most commonly occurs in patients on long-term therapy with multiple preservative-containing topical ocular medications. A common example is eye drop used by glaucoma patients. And lastly, non-specific conjunctivitis. It is possible to develop a red eye and discharge that is not caused by infection, allergy, or toxicity. The most common causes includes people with a naturally dry eye that causes redness or discharge, or a person with a foreign body, example dust or eyelashes that irritates the eye. All of these problems usually improve spontaneously within 24 hours. So there you have it guys, these are the 5 types of conjunctivitis that commonly occurs. Want to know how doctors treat these 5 types of conjunctivitis? Click on the link on the screen to find out more.